Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Michael Carlini. He's a physician coach. Today's Kevin MD article is Why Physicians with ADHD Are Burning Out. Michael, welcome to the show.
Thank you, Kevin.
All right.
Yeah.
So let's start by briefly sharing your story and journey, and then we could talk about your Kevin MD article.
Yeah. So I actually found myself coaching physicians after I started coaching basically high school age students and college students. I realized that this wasn't like the most fulfilling version of my work. And my wife being a physician, I really found myself gravitating towards working with medical professionals. So over the course of let's say 6 years, things have steadily transformed into me coaching physicians full time. So, yeah,
All right. And what are some of the most common issues that physicians come to you with?
I think it's honestly most of the time it's really dealing with burnout. Those symptoms of burnout really are just feeling like there's no sense of autonomy and control over their work and that it's taken over their life completely. So it's impacting their sleep, their physical and mental health, and it's also impacting their relationships. So it's so much easier for them to disappoint themselves or their partner than it is for them to disappoint their employer or coworker because it just doesn't feel like it's safe to say, "Hey, I can't do X or I can't do Y." Yeah. So that's honestly the most common challenges that people come to me with.
Your Kevin MD article is Why Physicians with ADHD Are Burning Out. So I'm interested in hearing specifically about that connection. So tell us what your article is about for those who didn't get a chance to read it.
Yeah, so my the focus of the article is really talking about that yes, physicians do have ADHD,
Hmm.
even though that they're high achievers with high IQs. ADHD doesn't discriminate in terms of who it impacts. It impacts people across socioeconomic background as well as intelligence. So I think that's the first thing that I wanted to make sure I covered in that article. And then the other part is really talking about what is causing these physicians to burn out is that they're trying to mask their symptoms of ADHD by compensating in the best way they possibly can, which is hyper focusing or really fixating on one specific task or giving this like hyper perfect version of themselves that they present to their coworkers, as well as really, I would say that's pretty much it. But yeah, I really think that that's the main points of the article. But I what I didn't really hit on as much, and I would love to hit on is when we're talking about burnout in medicine, I think it's often thrown out as, oh, this person's burnt out, but
Hmm.
we're not actually using any real assessment tool. It's more like, oh, well, this fits the description of what I believe burnout to be, but are we going beyond that?
So specifically with physicians with ADHD, how do they typically function in the clinic or the hospital setting? And you said that they may compensate for that with hyper focus, hyper perfectionism. So what exactly would that look like?
Yeah, that's a great question. Well, it's obviously going to depend on specialty. I would
Hmm.
say of my clients that are in the emergency medicine sphere, it's like, okay, I'm all gas during my shift, and my ADHD isn't really showing up in that.
Hmm.
But when I'm off shift, life is incredibly hard. Like, how do I get myself to do the laundry? How do I get myself to exercise or cook or pretty much do anything that's not work related because there's no urgency within that environment.
Hmm.
And then with my other kind of, let's just say, like family physicians or let's say hepatologists, for example, they're really hyper organized as to like, okay, well, this is my patient list for tomorrow. I need to review all of that so that I have a plan for everything. But that's taking a lot of time and a lot of effort, and it's
Hmm.
stealing it away from their personal life where they are really hoping to have more time for themselves or more time with their family. And so they're doing an amazing job at work, but it comes at that cost of, well, what about me? So yeah, I'd say that's a lot of what I'm seeing with the clients that I'm working with.
So physicians with ADHD are saying that at work they may be functioning okay, but where they would suffer is outside of work, and in contrast to physicians without ADHD.
Yeah, exactly. And I would say, I mean, that's not going to be universally true. I definitely have some of my physicians that are falling behind on documentation, who really are just struggling to meet the demands of the job.
Hmm.
And in those cases, we're really focusing on, well, how do we actually support you a little bit better so that you're able to get these tasks done and be able to have a healthy life. So yeah.
And what kind of tools do you use for these physicians with ADHD to help better manage some of these issues?
Right. So what I would say is has been extremely helpful in the last year or two has actually been having that AI scribe
Hmm.
software be available, whether it's through my chart or through some third party
Hmm.
software. It's been really helpful for dealing with that working memory heavy task of documenting these patient visits. So if you don't have to try to recollect everything, you know, 4 hours after you've had that patient visit
Yeah.
because it's been recorded, that's so much easier on your executive function and on your brain, really. So that's one thing. And the other thing is really using the tool of, okay, well, how do we build a template for these visits so that you're not having to regenerate, okay, this is what I need to cover and in what order.
Hmm.
So those are some of the tools when it comes to the documentation, because that's pretty much the largest burden on all physicians at this point. And then other strategies and tools are really just about ADHD specific time management. How do we plan and prioritize? How do we set goals? So yeah.
One of the things that you mentioned earlier is that ADHD sometimes is misdiagnosed or overlooked in high achieving medical professionals. What kind of symptoms do physicians have that may point to a potential undiagnosed case of ADHD?
That's a great question.
Uh,
I would say when anxiety is like incredibly prevalent and obvious on the surface, regardless of how well someone's functioning,
mhm,
right? So I see physicians who are like, I'm anxious because I need to make sure that I get all these things done, and not having much trust in themselves or their process to actually be able to get it done. And so I would say that's like the most common sign of it. And so, and what will often be the case is that these physicians will get treated for their anxiety, and their anxiety actually doesn't respond well to it, and it actually doesn't solve the challenge that they're having. And
mm.
so, yeah, that's what I would say is the most common example that I see in these physicians that are going undiagnosed and really kind of at a loss of like, well, why isn't anything that I'm doing working? I'm working extra hard and I'm constantly anxious about messing up. And there's just, yeah, I'm just at a loss. And so that's usually when people go and seek answers. But unfortunately, what I would say is a lot of psychiatrists and therapists are not super well trained at diagnosing people with ADHD who have high IQs, maybe didn't have any behavioral or academic issues or professional issues. Yeah,
Because they assume that if a physician finishes medical school and residency, how could they have ADHD, right?
exactly. Absolutely. That's exactly almost the phrase I hear most often, and it's probably the most frustrating.
Now, you mentioned that you would like to see some validated tools that can diagnose ADHD in high IQ individuals. Like, are those tools even available?
I would say that they're available in the sense of like if you get the right type of training or
Hmm.
you're getting trained by a mentor who focuses on specifically diagnosing, let's say, autism spectrum disorder and ADHD, they're probably going to be a lot more equipped to know what ADHD looks like in those contexts. So, in terms of like a more in-depth evaluation, it's one of those things where you could go through the full psychological battery of testing.
Hmm.
And if you're looking at it, well, this person might perform incredibly high in some areas of this testing and then relatively mediocre in some other areas. And the science basically says, like, okay, well, why is there that significant drop off by comparison to all these other areas of their testing? That's usually the indicator of, okay, well, this person could be diagnosed and meet the criteria for someone who has ADHD. But if you don't know what you're looking at,
Hmm.
it's really easy to go, okay, well, it's not that. So I would say it really is more about medical training and mentorship from people who are truly specialized in diagnosing and understanding ADHD.
So, in these physicians where their ADHD is either undiagnosed or untreated, what would be a typical path if their ADHD isn't addressed?
I've seen cases where someone's is having difficulties within their relationship, their primary romantic relationship, because their partner is really struggling to understand
Hmm.
why is it that you said that this was going to take you 25 minutes or 30 minutes and it's 4 hours later and it's 10 o'clock at night and we haven't even like been able to have a discussion with each other about our days or
Hmm.
do anything else together. What is going on? Like why would you like how do you not know that how much time something is going to take? And so what ends up being the case is okay, well, there's that frustration and conflict that keeps on arising. And eventually it leads to this tipping point of we need to do something about this. We need to look for what else might be a good explanation for this.
Hmm.
And that is usually when people will go and seek out a diagnosis. Now, what will often be the case is that because they've had so many other mental health professionals not recognize what might be going on, people are seeking out a more specialized diagnosis. So there's some great ADHD focused centers in this country. I would say the Chesapeake ADHD Center, which is in Bethesda, Maryland. I have no connection with them,
Hmm.
but their focus is diagnosing high achieving and women with ADHD as well as ASD. So those are the types of organizations where you go there and it's clear that they know what they're looking at. They know what it what the kind of peculiarities of how it presents in this population. And that actually leads to a more, I guess, complete understanding of
Hmm.
what might be going on. So yeah, I would say that typically ends up being the path to a diagnosis and to an effective treatment, which tends to really resolve, okay, well, we can now understand the partner can now understand, okay, what is this behavior? Why is this
Hmm.
happening? Is it intentional? No. How do we actually support each other in this relationship? And that really tends to transform things and lead to a lot more fulfilling outcome.
We're talking to Michael Carlini. He's a physician coach. Today's Kevin MD article is Why Physicians with ADHD Are Burning Out. Michael, let's end with some take home messages that you want to leave with the Kevin MD audience.
Physicians with ADHD are out there probably at the same rate as the general population with ADHD. They need support and are they are going to look a lot different from the typical cases of ADHD. When we're talking about burnout, we need to realize that this can't just be a catch-all
Hmm.
for the symptoms that you might be seeing in someone else. We need to dig deeper and we need to say, well, if there's a root cause, how do we actually address that and support these people so that we're not losing physicians to burnout? So I would say that's pretty much my main takeaways from this article.
Michael, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Yeah, thank you.